Okay, Assalamualaikum. Today we would like to present our project titled AI-driven Smart Clinic Triage and Appointment Scheduling System. This project focuses on improving the patient registration and appointment process in clinics. Many clinics still rely on manual triage where staff need to access patient conditions and decide which doctor they should see. During busy hours, this can lead to long waiting time, delays, and sometimes inconsistent decisions. To solve this problem, we developed a system that uses artificial intelligence to assist with patient triage and appointment scheduling. The system collects information such as the patient's age, symptoms, blood pressure, and body temperature. It then analyzes the data using predefined medical rules. Based on these rules, the system classifies patients into three categories: critical, urgent, or stable. After determining the priority level, the system automatically assigns the patients to the most suitable doctor or specialist. The AI concept used in this project are knowledge representation and rule-based reasoning. Implemented implemented using Prolog, this allow the system to make decisions logically and consistently while reducing human error. Um, Overall, this project helps improve clinic efficiency, reduce waiting times, and ensure the patients receive appropriate medical attention based on the seriousness of the condition.
All right. Thank you to Muhammad Arif Ashraf. So now, I will present to you and our SUI prologue. So first thing first, I will explain about the facts and rules. All right. So as we can see here, we have uh, the top of the this one is the facts that store all the information about the doctors and student. So for example, uh, the Dr. Smith is the specialist of cardiology. Dr. Jones is the pediatrics, and Dr. Lee is general medicine. So for the patient here, we have three patients, which is Ali, Siti, and Ahmad. So they have their age, their uh, blood pressure, their temperature, and also their condition. So uh, this this is the facts, and now we continue with the rules. So first one, uh we have a few priority which is critical, urgent, and stable. So how we determine their condition is uh, for critical we have two requirement which is chest pain, this one, or uh, high blood pressure more than 160 blood pressure. So whenever the patient fulfill one of these requirements, so they will determine as critical patient. Okay, for the next one is urgent. So urgent, they have two requirements that they need to fulfill, which is age must be less than 12 and temperature need to be more or equal to 29 Celsius. So if they fulfill both age and temperature, so they will be urgent. And then last but not least, which is stable. So when the blood pressure is less than 160 and also the temperature is below than 39, so the patient automatically will ascend to stable. All right, so we have three assigned doctor rules. For the first one, whoever the patient is critical, we will assign to them the cardiology doctor. And for the patient, for the child patient, especially when the age is below than 12, we will give them the pediatrics doctor. And lastly is the when the patient is stable, we just assign to them the general medicine. All right, so now we will continue to our test case, which is we have a few test case here. So first thing first, we have uh, priority Ali, priority assigned doctor Ali doctor. So the output here is priority critical and doctor cardiology. So why this output happen? Because when we see the facts of Ali, he has chest pain here, and also the blood pressure is 170, which is more than the requirement need to assign be critical. So, as I said earlier, for the critical condition, they just need to fulfill uh, one of the rules. Okay, so here when we see Ali have chest pain, so automatically he will be assigned to critical, which is here. And why the cardiology doctor has assigned to Ali is because we have also said in the rules where if the patient is critical, so the doctor assigned will be cardiologist. All right, so we go through for the second test case, which is CT. All right, so if you see here, CT is 8 years old. He has fever. The blood pressure is 110 and the temperature is 39.5 Celsius. So, uh, first we see the age here less than 12. So, he has fulfilled the first requirement of urgent condition. But for the urgent condition, we have need to fulfill both of the requirement, which is age and temperature. So now we look at the temperature of CT, and yes, he fulfilled the requirement, which is 39.5, where it's more than 39 that need to be fulfilled in the urgent. So uh, the priority is urgent, and for the doctor assigned is pediatric because the age, CT's age is less than 12. So I think that's all from me. We will continue to the other case, test case.
Hello. Now, I will continue from my friend's test case since he has already stated the first and the second test case. I will now move on to the third test case scenario. So, let's first look at the queries. So, the first and the second was, of course, using the logical and or statement. So, now for the third test case scenario, which is for Ahmed. So as you can see, Ahmed, the query shows that priority Ahmed and then to assign the doctor. So if we look at the logics that we put, so we already found the patient for critical and urgent. So let's look at the third urgency priority. So the third is the stable. So if we look at Ahmed's condition, since Ahmed does not fit within both of the two others agencies, since you can see Ahmed is 30 and then he has a cough, he doesn't have chest pain or fever, and his blood pressure is not above 160. So even his temperature is below 39. So it's not above 39 or 39. So Ahmad automatically does not fit within the critical or the urgent criteria. So therefore, automatically, Ahmad will be put under the stable urgency. So priority is the least prioritized. So therefore, that's why if I put into the query, it will show up Ahmad as in the priority as stable. So automatically, if his priority is stable, it will assign to a doctor that prioritizes in the general medicine. So that's for the third test case scenario. So the fourth test case scenario is, as you can see, priority name and then assign doctor name. So since for the query I put a placeholder name, so automatically it will look at the first patient that I put on. So automatically it will assign the urgency, the name placeholder to Ali, since that's the first patient that I put in. So as a placeholder, it will look at the name Ali first, and then it will look uh on Ali's condition. So since Ali fits the criteria of critical, the priority level as critical, then obviously it will assign the doctor to cardiology. So that's why the output will show up as critical, priority critical, and then doctor cardiology, since it will automatically first put the placeholder name as in Ali. So let's move on to the fourth and the final. So the fifth test case scenario is instead of finding the priority or what doctor to assign for the specific person, we will instead find the person that is responsible for the based on the facts that is provided. So as you can see, instead of providing the doctor name, we find what the doctor name is based on the facts. So as you can see here, we know that the doctor is in the cardiology, is an expert in cardiology. So automatically, it will look at the cardiology doctor that is expert in cardiology, which is uh, as you can see, the doctor is cardiology, Dr. Smith. So automatically, it will go back and then look at what doctor is an expert in cardiology. So for instance, now it's only Dr. Smith. Same as the other query here. So doctor for pediatrics. So for the pediatrics, as you can see also, the only doctor that is in the expert field of pediatric is Dr. Jones. So because of that, it will automatically display the output of Dr. Jones, that is an expert in the doctor, who is an expert in pediatrics. So in conclusion, our Prolog Expert system successfully accomplishes every single project objective. By automating the triage and scheduling loop, we remove manual wait times, human scheduling bias, and front desk errors. First of all, our system delivers absolute transparency and explainable AI. There is zero black box guesswork. Every automated medical recommendation can be traced back step by step to a clear clinical rule. So that concludes our group demonstration. Thank you so much and goodbye.